Hello there, everyone. We are ready for another episode of Ask Dr. Bob. And that's where you all ask me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association, to diabetes. And for those of you that have been tuning on all along, as you know, we have a different theme each month. This month is Mental Health Awareness Month, a really important topic, and I'm glad that we'll have a chance to chat about that. And welcome to the new people, and tell others to join. And I'll also put a plug. I am now on Twitter, something new for me, and it's at Dr. Bob Gabbay. So let's get started. Without further ado, let us talk about mental health, and let me pull up some of the questions that have been that we have. So the first is a great place to start. How are diabetes and mental health related? Well, for better or worse, they really are in a lot of different ways, and that's what we're going to spend our time talking about here. One thing that people don't appreciate is the role of depression. So it turns out that about 30% of people with diabetes at some time or another have depression. And people with depression are more likely to develop diabetes. So depression is really a very common mental health issue that people with diabetes struggle, and we'll talk more about that in a moment. Um, and then there's something else that a lot of people sort of haven't heard of, but once they hear about it, it sort of makes sense to them. And it's something that we call diabetes distress. So for a lot of people, having diabetes is causes a lot of distress, and we'll talk a little bit about why. But it's a lot. It's a lot to deal with, and it's normal to feel distress. And there are things that we can do about it, and that's what we'll talk about in a moment. So let me get to the next question, and that's why are people with diabetes at increased risk of mental illness? And so, for the depression piece, we think there's some biology here. So, depression, uh, you know, uh, is really to some degree it is a chemical imbalance in the brain. And we think of, oh, I'm a little down today. Well, this is sort of that feeling on a sustained basis. And there really are chemical changes that happen in the brain that cause depression. And that's why medicines that treat those chemical changes can be very beneficial for people with depression. So, part of the reason that people living with diabetes are increased risk of depression is it seems to be that they're more prone to those chemical changes in the brain that lead to depression. The second thing is this diabetes distress concept, which is really common. Um, and, for those of you with diabetes, you probably can appreciate this. During the course of a day, you're thinking about what your blood glucose levels are. What am I going to eat? What did I eat? Is it safe for me to exercise? Am I safe in place in terms of my blood glucose and how I'm feeling? Am I and then the bigger questions of, am I at risk for complications and what else is going on? All of that can be really overwhelming for people because it's every day. We don't get to take a vacation from diabetes. Uh, Although some people have said, you know what, sometimes I do take a little mental break, and hey, that's okay. We all got to do what we can to sort of keep going. So all of these stressors can cause anxiety, unhappiness, and this broader term of diabetes distress. So, the reason people living with diabetes are increased risk of mental illness is some biology and some it's a lot, and feeling overwhelmed, and nothing wrong with that. It's super common. I would say most all of my patients at some time or another uh, definitely feel diabetes distress and definitely feel overwhelmed. And that's why we're all here to help, and we'll talk more about that. So, the next question is, can mental health affect diabetes? Well, yeah, it really can in a lot of ways. Um, First of all, we know that people that are depressed are less likely to do the things to take care of themselves. They're less likely to be motivated to exercise. They're more likely to eat foods that may not be as healthy for them. All of that kind of stuff, not surprisingly, goes with depression. And distress feeds into some of that as well. People that have are feeling overwhelmed with their diabetes are less likely to care for themselves. Um, so here's another question. Can uncontrolled diabetes increase the risk of mental health problems? Well, yeah, I think in the sense that particularly the feeling, you know, when people have high blood glucoses and they see that, they can feel dejected, powerless, um, and they start to doubt their ability to manage their disease, and that doubt is really problematic because what we want to do is help people feel that they do have the ability to manage their diabetes, that they can ensure uh, with the proper guidance and oftentimes medications, be able to keep their blood glucose levels in a healthy range. So we're for those of you that are joining in late, this is Ask Dr. Bob with me, Bob Gabbay, Chief Scientific and Medical Officer for the American Diabetes Association. And we are talking about mental health because it is Mental Health Awareness Month. I'll just mention, all of what I've been talking about in terms of mental health has just gotten over the last 2 years more challenging for all of us. The pandemic has really led to a spike in mental health issues for literally for all people, but very much for people with diabetes. So this subject couldn't be more timely. So let me get to the next question. By the way, if you have questions you want to ask about mental health, please throw them in the chat and we will get to them as we have time. So the next question is, what steps can one living with diabetes take to manage their mental health? And I'm really glad that somebody asked that. And, you know, in some ways, I'm going to introduce a word that I think captures a lot. It's building something called resilience. People that are resilient can take on a lot. If you don't have a lot of resilience, boy, a little thing can just throw you over the edge. And I think we've all had those moments, right? Like, just some little annoyance, and you're like, ah. Well, so what can we do to help people keep their mental health in a good place? And so here are the things that I ask my patients typically to help guide them on what they can do. First, what do you enjoy doing? What what do you enjoy? Um, we all have something we enjoy, and as long as that's not an unhealthy thing to do, 'cause, people say, "Well, I enjoy eating banana splits." I'm probably not going to say eat more banana splits, but if they enjoy something that brings joy to them, do more of that because that builds your resilience. That builds your ability to feel that you feel good about yourself because it's really bottom line it's about feeling good about yourself. That empowers you to be able to take on whatever challenges diabetes throws your way. um, I also like to ask people, what do you do to deal with stress? um, because I don't know about you, but we all have stress, right? Like I haven't run into anybody that says, zero stress, never had any stress. We all have stress. So what do you do to manage that? And I will, sometimes people can give you their answers. Like, yeah, when I'm stressed, I do this. Well, yeah, then let's talk about how you can do that a bit more and how you can do it at the moments you're most stressed. But if you're unsure, let me throw out some suggestions. Um, One of the things that really helps people's mental health, and there are research studies that show this to be true, is exercise. Exercise has so many great benefits, and it doesn't have to be, going to the gym and, doing an incredible workout. It could be going for a walk, something as simple as that. Any kind of exercise. Some floor exercises at home. You have no equipment, do some stretching. Any of that. Exercise really helps mood and mental health. Um, there is something called mindfulness, sometimes called meditation. It can be just focusing on your breathing. Could be as simple as you're feeling really stressed. Take a moment and take 10 slow, deep breaths and just slow yourself down. That is powerful. Sounds like it doesn't do anything, but you'd be surprised. Give it a try. So that's another suggestion. What else can you do to help your mental health? So, people like different things. It could be reading, it could be music, listening to music, any form of artistic expression that you might have. If you like doing painting, drawing, any of that, fantastic. Uh, Writing, and it could be gibberish. So interestingly, there's a whole set of research studies that show that if people just write about what stresses them, it reduces some of that stress. It reduces some of that anxiety. So journaling, I do it. It helps me deal with stress. So that's another great thing. And the other thing that really there's a lot of evidence to suggest helps people deal with their mental health is support from others and connecting with others. And so, you know, picking up the phone and chatting with someone and just sharing a little bit, that can be really helpful. And I'll give you one last tip, and that is if you have available, get out into nature in whatever way. It could be just going to a park and just, it's springtime and looking at the flowers. Um, it's amazingly effective. And again, there is research studies showing that that's effective. So lots of options of how to help your mental health, how to reduce diabetes distress. Let me throw another thing that we often don't think about, and that is getting enough sleep. Um, we tend to do worse when we don't get enough sleep. Diabetes gets worse without enough sleep. People become more insulin resistant without enough sleep. People are more likely to have obesity if they don't have enough sleep. So lots of things. And the last caution I will throw out is I mentioned now I am on Twitter and I'm engaging in social media, but be careful. It can be overwhelming and it may not be the most relaxing thing to spend an hour on social media. So I know it's captures our imagination, but you know, think about that and how it might be effective. The last thing I want to say about this question of what can I do about my mental health is, it really is worth considering checking in with a professional. Um, all those things that I described are helpful, but sometimes talking to an expert and an outsider can really be helpful. Sometimes you need medication. Nothing wrong with that. And in fact, medication, particularly for depression, is highly effective. But, reaching out, the American Diabetes Association, we have a mental health provider directory. You can go to our website, and these are mental health experts that have been trained around diabetes. So not only do they know mental health, but they also know diabetes, and they can help you. So think about that. And honestly, one of the things that many of us believe is that it's probably good for all of us, or certainly people with diabetes, to check in with some behavioral health specialist sometime along the way and periodically to just check in. How's it going? How are you feeling about things? Okay, so we've covered a lot of ground here. I got some other questions here, and so this one is, how does how does one's diabetes impact family and friends? Well, that's a great question, and it can happen in a lot of different ways. And one thing that I would suggest is to maybe ask your family and friends. Some people feel funny about talking with others that they have diabetes. To whatever degree you can open up a little bit about that, you'd be surprised. Number one, diabetes is, for better or worse, so common. Most people understand. And being able to talk about it can help you. Uh, and you can ask them, particularly your loved ones, how do they feel about it? And um, tell them how they can help you, because many times they're more than glad to do so. Uh, and I will also say I've seen many examples where uh, loved ones trying to be helpful can be too helpful, right? We don't need sugar police around us telling people with diabetes every minute, are you sure you're doing that? Why are you eating that? What are you doing? That can be counterproductive. And so sometimes the message to loved ones is, give me a little bit of space here. I'm going to manage my diabetes. I'll tell you when I need your help. I don't necessarily need it all the time. So it's something to think about. Okay. The next question is around what about mental health issues at different ages? Well, I think childhood, adolescence, the college years, those are particularly challenging times. Young adults, now more than ever during the pandemic, it's been, I think that group really struggled the most with the pandemic because so much of that age is interacting with others. And when we all had to be in our homes and not able to interact in the normal ways, that was really tough. And so those are the individuals that really are at most risk, and those are the people to check in on. And if you are a young adult, I would really encourage you in many programs, including the Joslin Diabetes Center. We have all young people engage at some time with a behavioral health person just to have a chat and a check in. That's the same way somebody checks in on your body, someone checks in on your emotional state. It's a great idea, and I really think it can be very, very helpful. So we are running to the end. Let me see what kind of questions we have. I think we may have gone through all of them. I'm just going to take a quick look here. So let me sort of finish up and maybe try to tie all this together because I sort of threw a lot of information out. So this is Mental Health Awareness Month. What we want to remember is these challenges are really common for people with diabetes. Depression, very common. Almost 30% of people with diabetes have depression. So um, if that's something you think you may have, talk to your healthcare provider because it is very treatable. Diabetes distress, also common. Diabetes can be overwhelming. It's normal to feel overwhelmed at times. And there are lots of resources to help you, including things you'll find at the American Diabetes Association website. And what you want to do is think about how you can build your resilience. What can you do that gives you joy? Do more of it. Give yourself a break. Um, think about what recharges your batteries. The list of different things that I mentioned: exercise, getting outdoors, seeing nature, uh, deep breathing exercises when you're really stressed. All of that can help. And so, really, if I could have like a billboard and have something out there, it'd be, don't be afraid to ask for help, because so often people don't, and there's so much that can be done. So if you think you're having issues, reach out. Go to the American Diabetes Association website. We have a list of mental health professionals that can help you. Uh, and thank you for joining. As you know, this is Ask Dr. Bob. We do this every month. We pick a different topic. Send in your questions. Keep an eye out on social media. Continue the conversation on Twitter with me at Dr. Bob Gabbay. And thanks, everyone, and be well.